So, okay, if you look in the eyes of the person next to you, do you see a look of enlightenment and understanding the muscles? Or do you see a glazed look where your eyes are going
I'm focused.
the glazed looks in their eyes. They don't know what's going on. Anybody? Okay. So then maybe there's stuff that we need to go over again. So that's fine. We can do that. All right. But if there's certain things, or certain questions, or certain things that you have that you want to understand better, then let me know. So you can have an idea of what things we need to go over more. So if there's anything now you want to bring up, that's fine. Or we can get through the rest of these muscles and then we'll go through them back another way, and we can draw some more pictures or whatever it takes. Okay. So is there anything that anybody that can mention that would help them to understand this a little bit more? Other than just the fact that it's a whole bunch of stuff thrown at you at once and you need a little time to process. Okay. That's why if you think of it in terms like this, I know it's kind of haphazard the way it's drawn on there, but basically you divide it into different books and things. We'll talk about it differently, whether it's muscles of the shoulder, or muscles of the elbow, or muscles that cross the elbow, or muscles that flex, that move the elbow, or muscles that cross the wrist. But basically you want to divide it into chunks that you can handle. Okay? So we talked about muscles that go across the elbow. Okay? There's some that are on the front, and this is what they do. There's some that are on the back, and they do this. There's a few other little twists in there where you throw in pronation and supination. And then you move down into this area here. Then you have a lot of times the muscles are in this area, and if they're on this side, they do this. If they're on this side, they do that. So just go back to general basic concepts. You want to understand the general idea, and then you can get into the details. Okay? So we'll play some of these other videos that I didn't have on there, and hopefully the sound won't last. So now we're talking about flexor pollicis longus. Now what's flexion of the thumb again? Is it like hitchhiking or like this? This. Okay. So then where is that muscle going to be? On the front side or the back side? Front side. Okay. Is it going to be one of the more superficial ones that's going to come up from way up here? Or is it going to be more deeper? Deep. So it's going to probably come from somewhere in here. It's going to go somewhere along like this. And which of one of the phalanges are going to go to? The proximal one or the distal one?
Proximal.
If it was proximal, then all you could do is this. Are you going to need to do this?
A little bit.
Yeah. So let's say it goes to this. Okay, so then let's watch this.
We'll remove flexor digitorum superficialis to see it. Here's flexor pollicis longus, lying alongside flexor digitorum profundus. It arises from the anterior surface of the radius and from the interosseous membrane. Its tendon passes through the carpal tunnel with the finger flexors. Here's the tendon of flexor pollicis longus emerging. It enters the fibrous flexor sheath of the thumb and inserts on the base of the distal phalanx. Flexor pollicis longus flexes both the NP joint and the IP joint of the thumb.
Right, so then it's going to, depending again on what source you're going to look at, in some cases they'll just say that it's on the radius right here. Can you see that up there? Okay. So it's going to be here on this part of the radius, a little bit on this interosseous membrane, and a little bit on the ulna, but the basic thing about it is, again, it's more deeper, and it doesn't come all the way from the top. And so it's going to come across here, going to go through that retinaculum there, and it's going to go all the way to the distal phalanx. And it's going to flex the thumb all the way to the tip. Okay? Yeah, we did this one already. This one we didn't see.
Pronator quadratus, which arises from the anteromedial aspect of the ulna and inserts here on the anterior surface of the radius. Here's the action of pronator quadratus.
So then that one's basically going to be going across here. So it's going to pull the radius across like that. So that's pronator quadratus, flexor pollicis longus.
What's the function of that?
What's the name of it? Pronator quadratus says it pronates the hand. Because what's the shape of it?
4 sides.
Quadrangle? Like, well, they could call it pronator rectatus, but quadratus. It's 4 sides. It's not a perfect rectangle where it's all equal sides, but it's a quadrangle. So it has 4 sides, but they're not necessarily all equal. So it's going to pronate the forearm. And it works together with what other muscle? Pronator teres. Okay. All right, so we talked about the anterior compartment. So what does that leave us with? Posterior compartment. Okay. So when in doubt, go back to anatomical position. So keep in mind, when you see a picture like this, basically you're looking at like this, all right? But sometimes you may see images of the hand where you're looking at this, which would be anterior, and then now it's flipped over this way. So keep in mind that if this is the back side of the thumb, then these are going to be, now we're looking at extensors. You might get confused and you say, well, this should be the anterior compartment. But look at where the thumb is, okay? It's an extensor. If I do this, then yeah, sure, that's the flexor compartment. If I do this, that's pretty straightforward, that's extensor. But sometimes you see something like this, you know, or this. Keep in mind where they go from, lateral epicondyle to this side. The palmar side is going to be flexors. I'm sorry, medial epicondyle. Lateral epicondyle to the extensor surface is going to be extensors. So this would be a more straightforward view based on anatomical position. And then again, we're going to have some more superficial compartment versus, then there's going to be these other deeper ones that are going to go more specialized things to the thumb. Because in this view, actually, you are seeing some of the flexor muscles. Because this is lateral epicondyle, which is to the thumb side. When you look at this, still some of this meat over here is the flexor muscle. Okay? So you got the olecranon in the middle, the lateral epicondyle over here is going to be extensor. So anything that comes from this lateral epicondyle, which is on the side of the thumb, is going to be extensors. Okay, so you're going to have some general ones that are more superficial that are going to go to acting across the wrist, other ones that are going to go into the finger, and those again are going to come more from the lateral epicondyle. But then you get into some deeper ones, those are going to be the more specialized ones to the index finger, to the thumb, things like that. They're going to be shorter. So this is the more deeper compartment here. Okay, so they're going to go to the thumb and the index finger. And then also we have the supinator up here. So again, just in the same way that in here we had a superficial one that went to the 2 sides of the wrist, and then the one down the middle goes to the fingers. Okay? So then what's going to be on this side?